You're welcome to yet another episode of Easy Access to Healthcare for All, a program which keeps you abreast of its strides in moving Nigeria towards attaining universal health coverage. My name is Muhammadu Buhari, your regular anchor. The new National Health Insurance Authority Act is seen as a medium that will accelerate the country's efforts to bring access to affordable and quality health care for all Nigerians. The signing of this act by President Muhammadu Buhari has elicited support from development partners both within and outside the country, and some of these partners have visited the NHIA to pledge their support to full implementation. In today's package, we put together this visit and the issues discussed, and all towards ensuring a seamless implementation of the new Health Insurance Act. Join me after this timeout for details.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, NHIA organizes capacity building workshop for quality assurance officers. These and more coming up shortly. Do stay tuned.
Before taking questions, I want to give them the opportunity to introduce themselves.
In order to fulfill its mandate, the NHIA organized a one-day capacity building training workshop for quality assurance officers on Basic Healthcare Provision Fund Q&A tools in Kano. The training drew participants from state social health insurance agencies across the zone. In her opening remarks at the training, the zonal coordinator Hajia Khair Sada, who was represented, said the workshop is part of the ongoing reforms within the NHIA to intimate stakeholders on the quality of care being given to enrollees.
We've all known that of recent NHIs have been going through a lot of transformation, which led to the repealing of the NHIS Act, the NHIA Act of 2022. This workshop for QA2 is timely, so as to give us the ability to get used to the current trends that is going in the scheme. And also in health, standard cannot be compromised. So understanding the quality assurance tools and then how to go about it is of paramount importance in this activity. And just like the director from Jigawa have said, Basic Healthcare Provision Fund have come to stay.
Femi Adioye from the Standards and Quality Assurance Department gave a presentation at the workshop.
So when you look at the inputs, what are the things that make up the input? You look at the resources, the manpower, the infrastructure, the building, the equipment. These are the things we all put into the healthcare system to commence the process of delivering quality care. Now, if we look carefully, we've done accreditation. I'm sure we did most accreditation with all of you. We worked together, we did accreditation. These were the things we focused on most times during accreditation. We want to see if they have the personnel, if they have the equipment, if they have the infrastructure, if they have basic medications that will be available.
Some of the participants from the various states speak on their perspectives of the workshop.
This training is to build our capacity to ensure that we were able to have quality across board, so that what is said as quality in Zamfara will be the same thing as what we have in Jigawa.
The Gombe State Contributory Healthcare Management Agency, Go Health, has called on its public secondary healthcare providers in the state to build a critical mass towards enhancing service delivery in the state. Team leader of the agency, Dr. Abubakar Musa, stated this at a two-day meeting with the medical officers and Go Health desk officers of public secondary healthcare providers. He urged them to show commitment as they will reap from the system they help in creating, whether it be good or bad. Dr. Musa revealed that the meeting was organized to provide an update on Go Health implementation processes and also to discuss complaints and general challenges encountered with the scheme as it relates to service delivery. Also speaking at the event, Dr. Lawan Bala, Executive Secretary, Gombe State Hospital Board, stated that the meeting was not to witch hunt, but to establish a fora where all parties can learn. Activities at the two-day meeting included a training session on Go Health implementation processes and also updates on the Go Health online platform and mobile application. At the end, Dr. Abubakar appreciated the healthcare providers for providing efficient and effective service delivery that has boosted the confidence of Gombe State residents in public health facilities.
The program is easy access to healthcare for all. The NHIA Act 2022 was signed into law on the 19th of May 2022. This move strategically placed the authority on the path of attaining universal health coverage, as well as elicit global recognition and technical support. In the next segment, Issues Around the NHIA, we shall highlight what the Act holds for Nigerians, as well as some of the visits by technical partners who have come forward to pledge support for the authority towards the fulfillment of its goals. Keep watching.
What time?
19th May 2022 will remain memorable in the health insurance sector in Nigeria, as it is the day President Muhammadu Buhari signed the National Health Insurance Authority Act into law. This is a giant stride and is seen as a final game changer in the healthcare delivery system in Nigeria.
When this law was signed at the level of the TMC, we sat down and developed a strategy to first of all ensure that every stakeholder in Nigeria has appreciated the ABCD of this law. Because if we don't appreciate the law, it will be very, very difficult for us to implement it the way it should. So that's why we embark on a series of stakeholders engagement. And today's meeting represents one of the most important stakeholders engagement that we are going to do. For the fact that the 83 million vulnerable segment of the population that will be covered under the law, under this law, will be driven at the state level. It is going to be driven through the mechanism of implementation of basic health care provision fund. Therefore, the role of commissioners and the role of state health insurance agencies is very, very critical in implementation of this law.
The then NHIS Act 2014 was amended to help the authority achieve its mandate and to give Nigerians access to minimum basic healthcare at an affordable price.
So many reasons, but the key is the one that the desire to make health insurance mandatory. That was the main reason. Why? Because we have done tours around the world as an organization, and we have seen that when you make it optional, the desired success will not be recorded. And even in our case, from 1999 to date, to the 19th of May 2022, where the president signed the law, we did not have it easy at all.
This amendment signifies that more funds will be pooled, thereby giving a roadmap for the attainment of universal health coverage.
With the assent of this bill, the roadmap for attainment of universal health coverage has now been clearly defined. What we have been doing hitherto is just scratching the surface. It's to just talk without action, talking without action. You want to attain universal health coverage, you know that financial access is key, and you did not define a very clear mechanism of how to generate funds to cover the people that are uncovered. So it will just be mere rhetorics, but with the accent of this bill, it is walking the talk.
Highlights of the NHIA Act 2022 include change of name from National Health Insurance Scheme to National Health Insurance Authority because of its wider functions. Objectives of the authority are more defined to promote, regulate, and integrate health insurance schemes. To ensure that health insurance is mandatory for every Nigerian and legal resident, to boost the achievement of universal health coverage. Development of operational guidelines and review at least once in 5 years. Establishment of Vulnerable Group Fund, and many more. The import of this new act cannot be overemphasized, as it has put the authority on a trajectory of achieving its mandate and has strategically attracted development partners across the globe. One of such is the recent visit of Chiril Kashin, R4D's managing director from the Washington, D.C. office, who is a master technical facilitator and expert in health financing. R4D has partnered with NHIA on several initiatives, including development of the 10-year strategic plan, capacity building for management, as well as the NHIA Leadership Development Program.
But it also has its limitations.
The essence of her visit was to acknowledge the authority's efforts so far, and to also provide technical support for the authority.
In Nigeria, and for the NHIA in particular, really congratulations on the elevation of the status. It's such an important statement, I think, for the importance of the National Health Insurance Scheme, of this authority in advancing universal health coverage in Nigeria. We in the global community are looking on with great interest. We're feeling the energy right now at this moment, the energy and the commitment towards advancing UHC. And so to be able to be here and be part of that dialogue is truly an honor. As Dr. Hope mentioned, that at R4D, we really, of course, we know this is your way forward. It's your way forward to chart and to make happen. And what we can do, I hope, is to share a bit from some insights globally, some other observations and lessons that we've been able to synthesize, and just to share for you to possibly take along as you elevate the agenda for UHC in Nigeria.
Another of such visits since the signing into law of the NHIA Act is the week-long visit by the World Health Organization Health Financing Mission to the NHIA headquarters. The visit represents World Health Organization's commitment to NHIA as it begins its march towards universal health coverage and to identify ways it can support the NHIA.
Today I'm here because there has been a new development, the NHIA authority bill. And I'm here again because I believe that's the way to go. NHIA hold the promise to transform health access to healthcare in Nigeria. So this is really a good opportunity for us, and it's a privilege indeed, to be part of this high-level advocacy visit, to review where we are so far, how we will operationalize this new health insurance authority bill, and how WHO can further support to strengthen NHIA to deliver on a mandate.
During this visit, the delegation paid a strategic visit to the Secretary to the Federation of Nigeria, Boss Mustafa, where he pledged his support to the implementation of the new act.
So I want to thank Prof. and also the agencies that worked with you, because I know that it's a combination of agencies like WHO that worked with you in crafting, based on experiences of other jurisdictions, to craft a legislation that will serve our people. So I want to thank you for this visit, and whatever we need to do to resource this coverage in this particular budget, either by way of a special intervention or by way of providing for it in the appropriation, I think
In another strategic move, Roche Pharmaceuticals has also visited the NHIA to affirm its commitment to the previous MOU signed, which is to provide cancer medicines for enrollees at a subsidized amount.
Our current MOU, how do we ensure that with the cost-sharing model we've put in place, that it begins to touch, I think incidentally, even the First Lady mentioned and acknowledged this partnership. And her ask for us was to ensure that it touches the last mile patients.
As part of the endorsement by the development partners to the NHIA success story, Chatham House recently issued a letter of commendation to the Director General of NHIA, Professor Nasir Muhammad Sambo, for his contribution to the event and to the improvement of health status of Nigerians.
Welcome back. In our stakeholders segment today, we'll bring you excerpts from interviews with different players in the health insurance space as they speak on their perceptions of the NHIA Act 2022. We'll start in-house with Oluwafemi Akingbade, the Zonal Coordinator of Lagos State, as he shares his thoughts on the Act.
First and foremost, the joyful part is the part that actually now enables us to enforce health insurance in the country. What we had before was not mandatory, but what we have now actually mandates that every resident in the country must be under one form of health insurance or the other. And now, in the law, it gives us enough power to be able to regulate what goes on in the health insurance sphere.
For the GM Special Duties NHIA, Mr. Ayo Osinlu, he explains his belief of the signing of the law is an avenue to achieve universal health coverage.
The new law that has just been signed for the National Health Insurance Agency, you will agree, is entirely a watershed, a new beginning, kind of a fresh window in the efforts of the country towards the attainment of universal health coverage. And what the law intends to do is to mobilize every platform and every opportunity and every player to ensure that ultimately all hands are on deck to be able to attain universal health coverage.
Members of the delegation from WHO Health Mission that visited also spoke about the new NHIA Act and its implementation.
What we've seen here shows very important and, in a way, forward-looking investments in the infrastructure, especially the information technology infrastructure that will be needed to enable the system to be efficient in how it extends coverage.
Now the passing of the law is already a very strong step in this agenda to make sure that everybody accesses health services. Because when we talk of UHC, we are talking of services primarily, and alongside that, financial risk protection. So I think the readiness is there, the political will, because we had a chance to visit the Senate. We had a chance to meet the Minister of Finance. And I'm impressed personally by the alignment of the commitment, the alignment of the vision, the energy of the team working long hours.
Other stakeholders across the health insurance eco-space have not been left out, as they have also lauded the signing into law of the NHIA Act and the impact it will have on health insurance in Nigeria.
What we have here, the first gift that we have received from this is the mandatoriness of social health insurance in Nigeria. That everybody now must come on board. Now this to the shares, of course, for us at the shares level, the state level, most of us have laws that have made it mandatory, except for 2 or 3 other states. Now for those states that have not, laws that are mandatory, that have made health insurance mandatory for their residents, this is a leverage. They can leverage this law to ensure that they get all their, or they review their own laws to ensure that there's mandatoriness.
This act is what we've been waiting for since 2005. Because when NHIS was launched that time, people were worried that why was it not compulsory? This is a nation of 200 million plus. The only way to get them in is to make it mandatory.
The new NHIS Act is one of the transformative actions in the health sector in Nigeria. The main thing is to see how Nigeria can achieve universal health coverage. And you cannot achieve that if social health insurance is, if we cannot achieve that if social health insurance is voluntary. And so with this act that all Nigerians will be covered is key for us to achieve universal health coverage.
Like you've heard from different players, both within and outside the NHIA, the new NHIA Act is a much-awaited development that will give more Nigerians access to healthcare without worry of how much it will cost, while propelling Nigeria towards the attainment of universal health coverage. Up next, your questions answered. Do stay tuned.
Where do I register? How can I get? Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
We have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get? Where do I register?
How can I get enrolled? How can I get enrolled?
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
And so we draw the curtains on this week's episode of the program. You have a responsibility in helping Nigeria attain universal health coverage by ensuring that you and your loved ones are covered by one form of health insurance or the other. Find out how and get enrolled today. See you next week.